Good morning, everybody, and welcome to my show. I am Dr. Niru Prasad with my background in pediatrics, emergency medicine, and urgent care, affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our health talk is very interesting. It is a cosmetic gynecology. Joining us today on my show is Dr. Mona, and she is going to give us all the tips how we have to stay looking young, and she's a gynecologist. Good morning, Mona.
Good morning.
Yeah, so will you kindly give your introduction, because you sent me and you have so much thing going, so I said I better let you.
Hi, my name is Mona Hardas. I am a board certified in obstetrics and gynecology, fellow of American College of OBGYN, as well as fellow of American College of Cosmetic Gynecology.
Yeah. So this is very good, you have all those things under your belt, yeah.
Thank you.
So anyway, so now where do you practice at here?
I have two offices. I have one office in Flint, Michigan, and another office in Bloomfield Hills, Michigan.
Okay, great. So,
Yeah.
so your website is there, and then if anybody wants to connect with the Dr. Hurt, she can just look at the website. So now, first question, Mona. What is this cosmetic gynecology? I want to know myself for my own.
Okay, well, cosmetic gynecology is the subspecialty of gynecology.
Right, of course.
The name itself is a little bit of a misnomer because it's not just about beauty. It's also about comfort, about self confidence to a woman, about functionality, as well as, of course, restoring the anatomy back to normal.
Okay, so this is the cosmetic.
Gynecology.
So what made you interested in that specialty?
Well,
It's so unique.
It is. So,
I was so happy when I found I said, okay, we will learn something interesting. Gynecologist problem, we all know.
Right. So it's an interesting story, actually. When I got my board certification and started working as a general OBGYN,
Okay.
in my practice, I started seeing patients who had some concerns which had no answers for. So traditional gynecology training teaches us how to take care of a disease, how to take
Right,
care of
yeah.
a problem, but it never tells us how to, or teaches us how to take care of aesthetic needs or a functional needs of a woman.
Right.
So the area I was practicing in had a large subset of women who unfortunately in their childhood had a female circumcision done.
Right, yeah.
Now
yeah.
they were older and married now. So one of the patients came to me because she was having painful sex and didn't know where to go. And I had no answer for it because I was
Right.
never trained into it. I used to get patients with a menopausal, perimenopausal women,
Right.
symptoms complaining. Again, I was not trained into it. So these are the women who actually inspired me to go and look for a training and say, okay, how am I going to answer their concerns?
Yeah, so that is very unique, because you were right. People are getting old, they are premenopausal or postmenopausal, there are so
Right.
many problems. They are on hormones.
Exactly.
But they are unable to improve their look. So this
Right.
is what you have been doing, and I read a couple of articles and everything that has been written on this issue. The
Yeah.
more I read it, the more it is getting more interesting. Yeah, so that's good. Yeah. So you did get some extra training for this specialty.
Yes, as I said, in our traditional gynecology residency program, you
Yeah.
don't get trained, and there is not like a cookie cutter program where you go and get trained for it.
Right.
So I started looking. So my training consisted of few of my mentors. One was
Okay.
Dr. Goodman from California,
Okay.
Dr. Red Alinsard from California,
Yeah.
and Dr. Pelosi from New Jersey. Now Now these are,
I've heard about Dr. Pelosi.
have you heard
Yeah,
about him?
yeah,
Yes.
yeah,
These,
yeah, very
these
nice.
all three of them are like a pioneers in a cosmetic gynecology
Okay.
subspecialty. It's a
Yeah.
small subspecialty is evolving
Mhm.
right now.
Yeah.
So I was very fortunate enough to get trained from them. And then I did different, courses, conferences, hands-on training, cadaver courses, like trying to get the information from
So
everywhere.
that's how then you got, you mentored with
Yes,
those people.
with different people with different expertise, and
Yeah,
I
and then
collected.
now, then you got your board. And
Yes, I
so
did.
that's good. So now you have your two office, one here and Bloomfield and one in Dearborn, right?
No, in Flint and in
Oh,
Bloomfield.
Flint, yeah, Flint. But can you please tell me what type of patients you see in your practice there?
So, variety of patients. So the age range for my patient will be from teenager to like 70, 75-year old, because their concerns are different, right? For example, is a teenager who just started her menstrual cycle and she
Oh.
wants to be a part of, she wants to participate in sports, or
Right,
wants some
yeah.
freedom, wants to put in a tampon, but she can't because it's very painful, because she has a very tight hymenal ring. So maybe she will be my patient where I can help her. Or I could have a perimenopausal or postmenopausal
Yeah,
patient.
like a middle-aged woman.
Right,
Yeah.
who would coming in because she has excessive tissue on the labia, and that's causing discomfort, rubbing
Yeah,
against the
right,
clothes
right.
and whatnot. Or, recently with all these GLP medications, you see,
Yeah, I
people
know.
are losing weight a lot, right?
I
Rapidly
was
losing
reading
weight.
about that GLP and the losing weight.
Right. So then you lose a weight from the labia as well. So we call Ozempic vulva. So it
Yeah.
looks saggy. It does not look good. So I do fat transfer for that to get
Oh,
it
you
back
do
to
the
normal.
transplant. Okay.
And then I could even have a menopausal woman saying, I have a lot of dryness, pain during sex, or, the labia is, the vagina is very tight and narrow. I would help them. So
You
it's a range of patients, a range of treatments.
So, just for our viewers to know, Dr. Mona had us accept patient of all age groups,
Ages, yes.
starting from the teenagers to the middle-aged and then
To the older.
Okay. Do you by any chance treat men also?
I don't do that.
No,
I'm a
do that.
gynecologist, so it's mostly
Right, so
women.
no men.
No
yeah.
men,
But
no.
if men want to do, you will refer them to whoever. I'm sure there are people in the med section also.
Yes, urogynecologists most likely.
Yeah, that's what I was thinking. The urogynecology has so many specialties, subspecialties.
Right,
Right. Yeah. Okay. So now, what are the procedures? Yeah, you talked about what are the procedures?
So-
Mostly, when somebody goes to you, like,
Right.
let us talk about the middle-aged, like, people from working age
Uh-huh.
group 40 to 60 or 65.
Yeah.
So when they go to see you in your office, what do they expect?
So I have got non-surgical as well as surgical treatments,
Okay.
depending upon their concern and what they are looking into, right? So for example, I do hormone replacement therapy. We use exosomes, we use growth factors to help with the healing. We could do that. We have lasers and as well as radio frequency devices to help with the non-surgical. Surgical, again, if somebody says I have excessive tissue and it's bothering me, I would do labioplasty. Somebody had multiple, say, vaginal births and had episiotomies and painful scar. We do vaginoplasty, perineoplasty for them. As I told you earlier, that if there is a lot of weight loss and a sagging of the labia, we do fat transfer for that. So multiple different procedure depending on the need of the patient.
Whatever the need.
Yeah.
And also, when they go to you, how much time? These are all outpatient.
These are all outpatient
These are
procedure.
all outpatient.
Yes,
How
yeah.
much time do they expect
to
to to be there for your procedures?
So depends if it's a non-surgical procedure.
Yeah,
It's there's no downtime for it. It's done within an hour or so. If
Okay.
it's a surgical procedure, depending upon how many we are doing it, it's all done under local anesthesia.
Local, okay.
So there's no pain, no discomfort, but patient is awake. So
Yeah.
it could take me 2 hours or so. You would be watched post-operatively for any bleeding.
Right.
So about it's
Yeah.
about 3 hours or
About
so.
so
Yeah, yeah.
if somebody wants to make an appointment with
Right.
Dr. Hardas, they have to give themselves a minimum 2 hours, and
Right.
it could be non-surgical less, surgical more.
Be little
And
more.
after that, are they ambulatory? Or
Yes, a lot of my patients they drive back themselves. Some
Right,
have
right.
a ride, but some they drive back because it's done under local anesthesia.
Okay.
And we are constantly in touch with them. My office will call.
Right,
We don't charge for any post-op
Because
visits.
that is very important.
It is,
You know,
it
they
is.
follow up.
Absolutely.
Because sometimes what happens, like working in my office or, wherever, I do
Yeah.
some work at the plants, automotive plants also. So sometimes I'm called, some middle-aged lady, she is hurting and she
Right.
has a fainting spell. So
Uh-huh.
on talking to them, we found out that she had this procedure done. So we take care, we call their gynecologist
Assistant
and
to
then
that, yeah.
send them home.
Right. So nowadays, because of the virtual visits too, right? You don't have to, if you're not big of a problem, we can do a FaceTime call or a virtual visit. I have my patients submit me pictures and it can help them if they
Yeah.
can't leave work and come.
Yeah,
So
isn't-
there's different ways you can do the follow-ups.
Isn't it great? Now world has advanced, science has
It
advanced.
has.
Everything is virtual.
Exactly, yeah. So it's like a right
It is
away. if you-
virtual,
Yeah.
nothing, you go to the doctor's office, then
Mm-hmm.
you talk to the physician's assistant, the nurse, and they all is virtual.
That's right.
By the time
I
you
know.
go to the main doctor, you
Yeah.
are exhausted.
Yeah, you've seen so many.
But this is the way it is, science
It
has
really is.
advanced so much. Not only that, then the robotic surgery has
Exactly. Yes, I do
Yeah.
that too. So
come. Yeah, so
Yeah.
amazing, isn't
Yes,
it,
it is.
Mona? Amazing.
the technology has advanced so much, which is
What is
good,
going
though.
to happen when the third generation comes?
Yeah.
What will happen?
But it's helpful though, the technology has advanced so much.
Yeah.
And we are doing so many new procedures and so many new things which were not available
Which
say even
were
10 years ago.
That is true.
So,
That is
yeah.
very true.
Yeah.
The technology, the A1, artificial intelligence
Yes.
is great.
Yes, it is. To an extent, yes.
It's great.
Yes,
you,
yes.
you talk to them. You can Google them, and it is amazing.
Yeah.
So. So there is no age limit. The bottom line is for our viewers to know there is no age limit.
Right.
Any age person, a person of any age, they can easily call you, make an appointment,
Yes.
and then you will act accordingly to
Yes.
their age, whether
And-
it is surgical procedure or
Or
whether it is
non-surgical.
non-surgical.
And I also want to tell the viewers that my first appointment, which is a consultation, is free. So they
Right.
don't have to worry about, oh my gosh, what are the charges? It's
Right,
a free
yeah.
consultation. I really want to spread the word. I want to educate the women that it's available. Please use it. So they
Sure.
can very well, call me, do a virtual appointment or in-person appointment.
Right, sure,
And get an
yeah.
idea what's
You
out
can
there.
have a virtual appointment or you can have
in-person.
inpatient. That's very good.
Yeah.
So then that's the increasing is demand is because of the increase in technology, also increase in the competition. Look how much competition
Right.
we are facing these days. People are losing job back and forth.
I know, that's so true. And I think the increasing demand is also because of increasing information out there. Social media has a lot to do with that.
yeah,
So
social
now, as you
media
said,
has-
with the AI or Google, you can just Google and see it
Yeah.
available. It's out there.
Social
And you can-
media has a lot to do,
Yeah.
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 Yeah, social media can take you all over the world,
Mm-hmm.
right?
Absolutely, yes.
Yeah,
Yeah.
so that's very good. So then, what advice would you give out our audience?
Well,
What are the advices that you are going to give to our viewers who watch your show?
um,
Yeah,
I would say it's about time for woman to take her health in her own hand. Look
right.
at
Yeah,
what do you want? What is really important for you? If there is a concern, if there is a problem, don't just say, "Oh, this is just a part of growing up. I'm
right.
getting
Yeah, yeah.
older.
Don't
It's
sit
okay."
home and then.
No, it's so ingrained in our brains like, oh, it's just because of, menopause. For example, incontinence of urine
Right.
is
That
such a
I
common
was going to
problem.
ask you
Yes,
about
we have
this. Yeah.
several procedures
Leak,
for that.
leaking.
Simple, yeah. But women is like, oh, I had babies or I'm getting old. No, you have a concern. Please vocalize it. Please find your own gynecologist or
Right.
come and see a cosmetic gynecologist. And it can. There are treatments available. You don't have to suffer. Is what I really want to tell them. At
Right.
least
Yeah.
find out if it is a treatment out there, and I'm pretty sure 99% there's going to be something we can do about it.
Right,
So,
yeah. And
yeah.
you can easily fix the leaking bladders
Yes,
also.
absolutely. Surgically and non surgically,
Oh, okay.
both.
What are the non-surgical?
So,
Just
one of the very good treatment non surgically is one is a radio frequency waves. It's treating the vagina and underneath of the bladder with radio frequency. Works great because what it does is that it stimulates more collagen and elastic tissue,
collagen tissue.
and it
Yeah,
also increases the blood supply, so it tightens it. So if your bladder is, say,
yeah.
prolapsing a little bit, it's gonna
Yeah,
help.
and there is
Right. So
inconsistency. Yeah. The sphincters are
incontinence.
getting loose, in
Right.
other words.
Right. So to make the sphincter tighter, we use something called a PRP, or a platelet-rich plasma. So
Oh,
that means drawing your own blood, and we
oh,
separate your blood cells from the plasma. Now,
okay.
plasma has growth factors, right? It has got a bunch of growth factors. So we get that concentrated growth factors and we inject it around the urethra,
Okay,
the
so
urethral sphincter. So
oh,
what it's going to do is going to stimulate the growth of the sphincter muscles, and it's very effective. And one injection, it's a shot, it's one injection which lasts you at least 1 year.
really?
So it's that simple,
It's
no
good to know
downtime.
for people
Yes, it
who are
is
listening and watching our show that
absolutely
you draw some blood,
their own blood. So
their
there's no
own blood.
medicine, it's your own blood, it's your own tissue. We're just putting it in the area. Within 3 weeks, you're going to start noticing a difference.
So now, how long does it take for the plasma to grow
About
the
half
fibrils?
of about 3 weeks, because
3
it
weeks.
stimulates the growth, right? So you're gonna start noticing like my incontinence is getting better by 3 weeks, and by 3 months is the
No,
best
what I
results.
mean to
Oh, when we
ask
prepare
you,
it.
what I mean to ask you, like the plasma, when you draw the blood, you send it to a special lab,
Nope,
right?
we do it right. We have the machines in the
Oh,
office.
you have the machine.
Yes, right
So
there
is
in
it
front
like
of you.
Is it like a centrifuge?
It's like a centrifuge.
Okay,
Yes, it
okay.
is. Because it's a live tissue. We want to put it in right away in you, right?
Right, yeah,
So we draw it and we prep it and inject it in you.
Okay.
But injection is done with anesthesia, so there's no
Oh.
pain. I just want to make sure
Okay,
people know that.
You
So.
centrifuge
Yes,
them and
yeah.
then save the plasma because plasma has got fibrins and collagen.
Collagen,
And then-
fibrin, growth factors, interleukins.
And then
so
you
much.
inject it. Oh, that is
Yeah,
very
yeah,
interesting.
it works
It's
really
good
good.
for our viewers to
Yeah.
know because a lot of women, they don't come out with
They
this
don't. I
because
know.
they have a leaking bladder.
I
Yeah.
know they are ashamed, but they shouldn't be. I would say 70% women have whosoever have vaginal deliveries.
Exactly.
It's
But
a
I
common
know,
problem.
especially the multi-gravity.
Yes,
Yeah.
absolutely, yeah.
Several deliveries, and then everything
Yeah.
is weak, right?
Mhm,
Yeah.
mhm,
That is
yeah.
very interesting. Yeah.
Yes.
I'm sure that people who are watching your show will definitely, concentrate their mind about this particular issue.
Yeah.
The other issues are there and you
Mm-hmm.
have a treatment.
Right.
But most important thing is to correct your leaky
Leakage,
bladder,
absolutely.
and then you go to your face.
Yes, yes, yes. I do facial
You agree?
procedures too, non-surgical, I do.
No,
But
yeah.
being a gynecologist, I concentrate more on this. So,
Exactly,
but I
right.
do
Yeah,
the
yeah.
others
What
too.
kind of cosmetic brand do you use?
Well, it depends. I do the Skin Medica products, which I really like because they have research behind it in medical
Oh,
journals. So I like those. And then I also like for exosomes, I use plated. So these are the exosomes from the platelets
special,
produced.
yeah,
Yes, yeah.
okay. So
I do
this,
also have a bio, nowadays everything is bioactive instead of fillers. We use this is called Renuva, which it stimulates your own collagen production instead of
oh,
putting any
inside
filler in you. Yeah,
okay.
yeah.
Instead of filling, because you put the filler, but now you
Mm-hmm.
have your own product
Exactly, yes, yeah.
that you can use.
Yes.
That's very good to know. That's very good to know. So then, is there anything else you would like to talk about? We still have a little time.
Okay, well, I would like to tell the audience that there are certain I did tell you about certain procedures I do,
Right,
but
right.
there are procedures and treatments for women, especially in a menopausal and a
Yeah,
perimenopausal
yeah.
age, where say you had say maybe a diagnosis of breast cancer, you had a chemo
Right, yeah, we
radiation.
did not touch that particular
Right,
area.
right. And
The
or you have
particular breast cancer.
family history of breast cancer, or some people who don't want to take hormones. I don't want them to say, oh, I can't take hormone, I have all these symptoms, I
Yeah.
have to suffer. No, you don't.
Oh,
We do have so many products out on the market, as well as treatment options, that they
right.
don't have to. So if there are women who are suffering with this, because you may go because of chemo early menopause, and you might be in your 30s and 40s and have symptoms.
That is
So
true.
don't
That is
suffer.
true.
Please seek treatment, is what I
Yeah.
really wanted to emphasize.
We talked about the menopause, but there are so many women with the breast cancer.
Right,
Yeah.
right. So for them,
Uterine cancer, and for every single thing, there is some kind of treatment
out there.
available right now.
Absolutely.
Yeah.
Now these treatments may take few months, before you notice the result, because we do it very slowly.
Slowly.
But it builds up and is forever, as long
Yeah.
as you stay
It's
on
better
to
to
the
be slow and
Yes.
do a good job rather than, jump
yeah,
in.
jump into it. Yes, I
Yeah.
agree with that.
So,
And there's no cookie cutter treatment. Everybody, because we could combine non-surgical and surgical together, or
Together.
do the hormones first, or just do the
Right.
bioactive materials like like
Yeah.
exosomes or something. So depending upon the need and the desire,
There is,
we
yeah,
can
yeah.
tailor make the program.
So now, since the medical science has advanced so much, the research is advanced, every single thing is available nowadays. Yeah.
It's available if you go out there, and I say you can Google it, you can ask AI,
I
you can do
know.
your research and bring your
Yeah, yeah.
questions to me.
Sure.
It's nice to have a very educated patient, because they would know about it and makes my life easier.
Yes.
But I think go ahead, seek treatment. It's about you.
Right.
As a mom, as a husband, as a wife, we
mom,
do
yeah,
everything for
wife,
other
yeah.
people.
Even if
right?
you live, yeah.
Yeah, for your husband, for your kids, then for your parents. But
Yeah.
there has to be a time to take care of yourself
It does,
as well.
yeah. And also, I wanted to ask you, like, people are, if some of them senior citizens in the nursing homes and all that, you must have some house call, send your
I do something called a pessary management. I don't know if you ever heard of
palliative management.
no, pessary. Like people have prolapses, right? Older
Right,
patient
yeah,
from
I
the
was going, that prolapse,
the
yeah.
prolapse. So it doesn't has to be surgical management.
Right.
There are devices we can
So you
insert to
tell
hold
them-
everything up.
you-
Yeah.
So
Yeah,
you
so
can
you
tell them.
fit them with the right size pessary, and then that holds everything up, and every few months they have to come to me to
And
clean it and reinsert it. Makes their life so much easier.
much easier,
So much, because
because
bladder prolapse and rectal prolapse so
I
common.
know, I'm working at the emergency room and I see those women, with the prolapse. And, they're so miserable.
Of course, yes.
They're so miserable, the whole
Yeah,
thing.
because it's right in between your legs. It's like, rubbing. And plus they have incontinence because of that. So,
Yeah, right.
So
And
there's
then it
treatment.
creates an infection.
It does. It
And the
does.
one thing leads to other, there's a whole cycle. Yeah.
It really is. So I think, so there are management and treatment options for them as well.
Good. Okay, so
So,
that's very good. That
yeah.
was one last thing I wanted to ask you.
Yeah.
About the prolapse vagina, prolapse
Yeah.
uterus, and all those, and then this one can be done.
It can
Yes.
be done, yes. There
Yeah.
are non-surgical, because a lot of time older patients, they are not surgical candidates too.
Right,
So
right,
surgery is
yeah.
there, but if you are not a surgical
cannot
candidate,
do
there are non-surgical management.
So
Yes.
that's good. We covered each and every aspect of the cosmetic gynecology. So now I like to thank our viewers for watching me on Health Talk with Dr. Mona Hardas, and she is a specialist in gynecology. She is board certified in all the different aspects of gynecology. I like to thank our viewers for watching me on Health Talk today. I like to thank our producer helping me produce these videos. And until I see you again, have a very safe and a wonderful fall and a winter. Thank you again, Mona.